This is LiveWell Talk on MitraClip. I'm Dr. Dustin Arnold, Chief Medical Officer at Union Point Health, St. Luke's Hospital. MitraClip is a minimally invasive procedure for patients with mitral valve disease or issues. Joining me today to discuss these mitral valve conditions and how they are treated with MitraClip is Dr. Nidhi Madan, cardiologist with St. Luke's Heart Care Clinic. Dr. Madan, welcome.
Thank you, Dr. Arnold.
First podcast.
That's right.
All right. Well, could you explain to the listeners what the mitral valve is and what it does?
Yeah, mitral valve is one of the 4 heart valves that we have. We all have 2 heart valves on the right side, 2 on the left side, as we describe it. Mitral valve sits between the left upper chamber and the left bottom chamber of the heart, or the pump of the heart, and it works to open and close in one-way direction. It allows blood to go from the left upper chamber, called left atrium, down into the left ventricle, and then it closes back so it doesn't allow the blood to leak backwards.
So it prevents the blood from leaking back into the... and the mitral valve is shaped like a mitre hat, and we have a new pope. So that's all ties together.
That's right.
What are some conditions that someone might have with mitral valve disease?
Right. So mitral valve disease can represent as either a narrowing of the valve or leaking of the valve, or called as regurgitation, where the valve doesn't close properly. Stenosis or narrowing of the valve is where the valve doesn't open all the way and it has a restricted motion. Mitral valve disorders can come either from something congenital, where the valve itself is not formed properly. Sometimes it is more thick than normal, leading to what we call a prolapse of the valve, where the valve leaflets are thickened and they don't close properly because of the thickening. Can result into leaking or stenosis. Some infections can also affect the mitral valve. Rheumatic disease is another cause of mitral valve problems. In fact, mitral valve is one of the more commonly involved valves with rheumatic fever or rheumatic heart disease. We don't see that very commonly nowadays, especially in the United States. But
no, I mean, 1944 is the first person in Cedar Rapids to get penicillin. Oh. So with the advent of antibiotics, rheumatic fever is certainly less of a concern. I mean, some of the immigrant populations or indigenous native, I know Eskimos, that's always on your board test. Yeah. Pregnant lady.
Right.
Mitral stenosis, and it's a history of rheumatic disease. But yeah, you're right, you do. So, but there is still mitral disease out there.
Absolutely.
And this is an option to do it. Well, what do you do during a MitraClip to fix that?
Right. So MitraClip is a minimally invasive technique. It's an approach to work on the leaky mitral valve.
Okay.
Where the mitral valve leaflets don't close all the way. And as we discussed, some of those diseases can come either from birth, where it's just so thick that it doesn't close properly, or it has a prolapse. Second part of it is if the ventricle, the bottom chamber of the heart, if it enlarges for certain reasons, whether it be a heart attack where it causes it to become bigger in size, or what we also refer as heart failure, can make the chamber bigger in size, in which case the valve is not the problem. The valve was properly present, but because of the stretching of the heart chambers, it separates out and doesn't close properly. So those are the 2 main scenarios where we would use a MitraClip to help with the leaking, where the blood backflows into the upper chamber of the heart and from there pushes pressure on the lungs. And that's how people feel the symptoms of shortness of breath or fatigue, or have fluid accumulate in their lungs.
Or it can be just a chronic cough. I've seen they get worked up for reflux and asthma, and it's actually mitral stenosis that's causing it.
Exactly. From the procedural standpoint, the clip has 2 arms, and similar to mitral valve itself, which has 2 leaflets. They need to open and close. When they close, if they don't come all the way, that's when the leaking is happening. So with the clip, which has these 2 arms, we grasp onto each leaflet of the mitral valve. It has a gripper arm where it will attach and keep that leaflet once you grasp it in place, and then we can close the clip, and that way the leaking is reduced.
And how long does that last? Is that a definitive once it's done and one and done sort of procedure?
Yeah, that's a great point. I think it does give us a very good result and should give us a durable result. The leaking of the mitral valve could return if the chamber sizes again continue to enlarge, whether the top chamber or bottom chamber in certain heart conditions can continue to have that problem. The hope is that once the MitraClip is done, leaking is reduced, we get the patient out of that vicious cycle of more leaking, bringing on more enlargement of the chambers. So the remodeling of the heart can occur and give us a durable result with the clip. So would not say one and never will see it again, but it does give us a good long-term outcome for
That's
some
great.
of the patients, especially if they are not candidates for open heart surgery.
But if you describe congenital, you really can't do, you can't do anything about that as a patient. But what about other causes of mitral valve disease? What can a patient do to avoid that?
Right. I think knowing about these different causes that can affect the valve function or structure, we should pay attention to some of the other medical conditions as well, simply as atrial fibrillation, which is such a common irregular heartbeat. As we know, atrial fibrillation we see is in older population very commonly. The upper chambers of the heart get affected and can enlarge in size, bringing on more AFib. And that also separates the mitral valve. So a simple condition like that does affect the mitral valve function and it can make it leaky. Similarly, if someone has suffered a heart attack and their lower bottom chamber of the heart is become weaker now, they can also result into a leaky mitral valve. So if you have any of those conditions, I think getting surveillance testing done with an echocardiogram, simple ultrasound wave test of the heart, to look for these leaking and keeping an eye on it. If you have mild leaking where that may just be the start of a process, we want to monitor that. And if time comes or symptoms are brewing, we should bring it to the attention of the cardiologist that the patient is following or the medical doctor that they are seeing to get next steps looked into.
Yeah, mitral valve prolapse was before routine use of echo. When I was first coming out of training, was everybody had it, and then as people get older, the mitral valve would stiffen a little bit and the prolapse would be less, and then it'd go away, and that was always something to deal with in the clinic. But that was pretty common at one point. Right. Everybody had it, and not so much these days. So you told us what the procedure is. What's the recovery from that?
Great point. So the recovery is not as bad at all. We monitor the patient in the hospital for 1 or 2 days, and they are up and around on their feet the same day. After the procedure, we have a small amount of bed rest for 4 to 6 hours, and then they're up and moving around, can go home the next day.
Compared to an open heart surgery.
Right. So comparing to open surgical approach, this has really revolutionized all the ways we can take care of the valve disorders.
If I have a mechanical valve placed, I obviously have to be on a blood thinner, oral vitamin K antagonist, Coumadin. What about MitraClip? Do I have to be on a blood thinner?
Right. No, answer is no.
Yeah.
We just use aspirin, a baby aspirin, and Plavix. Plavix is another stronger type of aspirin. Works in a similar way on the platelets, and we similarly use these in stent procedures as well.
Right.
We use a combination of these aspirin and Plavix for about 3 to 6 months initially, and after that, just baby aspirin is continued. If for some reason patient is already on a blood thinner for AFib or other reasons,
you keep it going.
We then keep that going, and no need for additional blood thinner.
Well, Dr. Madan, thank you for joining me. Once again, this was Dr. Nidhi Madan, cardiologist with St. Luke's Heart Care Clinic. To learn more about heart care services at St. Luke's Hospital, visit unitypoint.org/CR-Heart. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers. about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.